You know by the nature of your work that many children are abused, and most of them are unrecognized. I'm going to demonstrate to you that a large part of any adult medical practice consists of dealing unknowingly with the problems that result from distant child abuse. I'm Vincent Felitti. I'm an internist, not a pediatrician, not a psychiatrist. I run the Department of Preventive Medicine at Kaiser Permanente here in town. We're going to talk about how these consequences of child abuse show up in adults, why they're not recognized, and what we might do to improve the situation. I think I will move from the concrete to the conceptual and back to the concrete, from the specific to the general throughout my presentation. And I'll begin by telling you about an interesting patient I saw a very long time ago. I think it was in 1969 in the emergency room at Kaiser Hospital here in town. An overweight young woman in her early 20s showed up, kind of messily dressed and sort of a dumpy-looking, dejected person, and she had acute cholecystitis. And I explained to her that I thought she was ultimately going to need to be operated, but that she would simplify things greatly were she to lose about 70 pounds. So I gave her some medication. She went home. 3 months later, I saw her again. And much to my amazement, she looked quite different. She was now slender, attractively dressed, was surprisingly nice looking, and no longer had this sort of hangdog appearance to her. But the really striking thing was that she had lost not 50, not 60, not 65, but exactly 70 pounds. I was quite frankly astounded. I thought, my God, I mean, for the simple device of saying that, you mean this actually happened? She was operated, and I saw her again about 3 months later. And again, she looked sort of dejected and kind of dumpy looking, and had regained not 50, not 60, not 65 pounds, but precisely 70 pounds. And that, I thought, was the end of it. But for the next quarter century, I often thought about that woman. This really rather striking 3 meetings and this quite remarkable, precise, major weight loss, major weight regain. 26 years later, about 3 or 4 years ago, I was asked to see a patient who had lost 150 pounds. In our weight program, we run a rather large weight management program here in town with about 1,500 patients a year in it. A woman who had lost 150 pounds, and rather than being happy, as one might naively imagine would be the result, she was manifestly terrified. And lo and behold, it turned out to be this exact same person that I had met 26 years earlier in the emergency room. And for the first time, I learned what the whole story was and how this all made sense. How she had been repeatedly molested as a child, how no one in her family had believed her, how she tried to escape her family by marrying at 15, making a horrifically bad choice in her marriage, really being brutalized, eating out of anxiety, discovering that when she became fat, her husband became less jealous and paid less attention to her. It was really rather a striking story. The details of it, if you are interested, are available on 50 copies of a videotaped series of interviews that she and I made over 3 years, and she is willing to share this information with other people who have a serious interest. I brought a number of videotapes with me, all from patients who are willing to share that information, that it might be useful to others. Hers is titled The Ella H. Interviews, so if you would like a copy, please take one. She tells the story far more meaningfully than I. About that same time, we were beginning to discover that in the weight program, the biggest problem we had was patient dropout. And what was unusual about that was that the overwhelming majority of people dropping out of the program were dropping out in the midst of manifestly successful weight loss. And after doing careful timeline interviews with 186 people who were in the course of dropping out of the program, only then did we begin to understand that the biggest problem we were facing was the terror that was brought on in many people by the sexual threat that they felt when they lost substantial amounts of weight. This was really kind of an extraordinary thing. You know, we naively had thought up to that point, well, people say they want to lose weight and they'll be happy when they do. Categorically, the most prevalent problem, hardly the only one, but the most prevalent problem that we run into in that program we now understand is the issue of sexual threat that is exposed by major weight loss. And interestingly enough, the origins of that traced back decades to adverse childhood experiences. Ultimately, we came to see that the problem we were looking at was really only the tip of the iceberg. Obesity was something that we have an easy way of measuring, called scales. But there were large numbers of other associated problems that became evident the more carefully we looked at these people. Things like chronic back pain, chronic headaches, chronic abdominal pain. I mean, after all, what disease has combined obesity and chronic abdominal pain? I certainly know of none. That obesity was simply an easily visible marker for many other profound things which were affecting the way people led their lives, their health status, the cost of medical care, really the ineffectuality of medical care. Ultimately, this seemed so important to us, the breadth of the ramifications of adverse childhood experiences decades later in the lives of these adults, that we started negotiations with the CDC and Emory University that led to a 30,000 patient study, the so-called Adverse Childhood Experiences Study, where we took 30,000 adults coming into the Department of Preventive Medicine. Given the volume we see, that's about 8 months' work for us, coming into the department for complete biopsychosocial medical evaluation. Taking 30,000 people and asking them to help us by answering a detailed and highly intrusive questionnaire about adverse childhood experiences. To our surprise, 71% of the people we asked agreed to cooperate. And I have many letters of gratitude, all of which are of the general nature. Thank you for asking. I feared that I would die without anyone ever knowing. Let me show you the structural details of the ACE study, and then what we learned from it. The patients come from Kaiser Permanente here in town. The analysis was carried out both at CDC and by people at Emory University. The purpose of the study was to assess the long-term relationship between adverse childhood experiences and, in adults decades later, health behaviors, health status, disease conditions, quality of life, and a prospective arm, which is still underway, looking at healthcare costs, pharmacy costs, medical utilization, disease prevalence, and mortality. Actually, I have some mortality data already that I will show you. The study was carried out in 2 waves. In the first survey, we sent questionnaires to 15,000 patients. They came in for a complete biopsychosocial medical evaluation that they had requested. And as I say, 71% agreed to help. We tuned up the questionnaire a little bit to learn some from our mistakes, and recently have finished survey 2, the remaining 15,000 people. We now are in the prospective part of it, where we will take the 20,000 or so cooperating patients and look at their doctor office visits, their emergency room visits, their pharmacy costs, their inpatient costs, etc., and ultimately look at hospital records and death certificates over the next 5 years. So we have a prospective as well as a retrospective arm to this. So that's the general nature of the study. It is a huge effort. The things we looked at, we broke down into 7 categories. There were 3 categories of abuse: psychological abuse by parents, physical abuse, sexual abuse, and then there were 4 categories of household dysfunction. Was somebody in the household a druggie or an alcoholic? Was somebody in the household mentally ill? Was the mother being treated violently? Was anyone in the household in prison? So these were the 7 categories that we looked at. Now, it's perfectly obvious that there might be a huge depth of experience, variation in the depth of experience in any of these categories. Is there 1 alcoholic in the house, or 4? Is there 1 person in prison, 2 people in prison? Has a child been molested once or 17 times? We did not make any attempt to discriminate that. Simply exposed to the category, be it once, twice, 20 times, simply exposed to the category. So what we call the ACE score, the Adverse Childhood Experience score, can range from 0 to 7. Either one had no exposure to any of these categories, or one was exposed to 1 or 3 or 4 or 7 of these categories. So I will refer to this as the ACE score. First, I think it's worth noting the prevalence of each of these categories. Now, if you are from Southern California or certain other parts of the country, you'll be quite familiar with Kaiser Permanente. It is a huge medical organization. It is the prototype for HMOs. We have about 9 million patients in the United States, most concentrated on the West Coast. Basically, you would have to say that our patient population is a middle-class population. We don't have people who are chronically unemployed and destitute. We have relatively few multimillionaires. In other words, they are basically people like you and me here in this audience. When we looked at the category of psychological abuse, repeated humiliation through childhood, that turned out to be 11%. When we looked at physical abuse, and we're talking here about heavy-duty stuff, you know, repetitive beating day in and day out kind of thing, prevalence is 11%. Sexual abuse by anyone inside the family or outside, for men and women combined, is 22%. Remember, these are people like you and me. These are us. When we look at household dysfunction by category, alcoholics, drug use, 26%. Mental illness, be it severe depression and dysfunctionality up to state hospital, 19%. Suicide was also listed in here. Mother treated violently, 13%. Someone in the household in prison, parent, brother, whatever, 3%. Kind of high. When we looked at the prevalence of the categories, we saw that a little more than half of the people had either no or one exposure. And that one exposure could be to anything, could be to alcoholic parent, you know, imprisoned relative, molested, etc. When we looked at the number of people who were exposed to 2 or 3 categories, we saw that was basically 1 in 4, 24%. When we saw the number of people who were exposed to 4 or more categories, that was 21%, 1 in 5. You learn a lot by asking. What was amazing was how willing people were to talk about these things, because these are largely considered to be taboo subjects. Family alcoholism and incest are not considered to be subjects that are broachable. "45% of the people reported," these two here added, that they had 2 or more adverse childhood environment factors. That's kind of impressive. Well, what does this mean? How does this play out? How does this play out decades later? If we move forward only a small number of years and look at adolescence and rate intercourse by age 15 against ACE score, what we see is that the lower the ACE score, the lower the likelihood, 7% of intercourse by age 15. The higher the ACE score of 4 or more, the higher the probability of intercourse by age 15, and it's 27%. So that's close to a 4-fold increase. You will see on the slides that I show repeatedly this dose-response effect. The ACE score gets higher, the damage score gets higher. And we will move progressively later into life so that you'll see that this isn't just some short-term effect. This is a major and dominant effect 3, 4, 5, 6, 7 decades later. If you look at teen pregnancy, subject of a great deal of interest, what you'll see is the same dose-response effect between ACE score and teen pregnancy. If you look at teen paternity, you will see the same dose-response effect. The higher the ACE score, the greater the probability of teen paternity. I should point out that all of the information that I show you has a p-value of better than 0.001. So the chance of any of this being a statistical fluke can be forgotten about. If we look at the number of sexual partners, which is of interest in terms of sexually transmitted diseases, particularly AIDS, and look at people who have had 50 or more partners in a lifetime, what we see is again the same thing. Here we'll introduce the term adjusted odds ratio, and we'll use as the reference point people with an ACE score of 0 who had 50 or more partners, and we'll call that an odds ratio of 1. And so what we see is that as the ACE score goes higher, the probability of having 50 or more partners goes higher, and ultimately the odds ratio is 3.2. In other words, it's a 320% or 3.2-fold increase in that likelihood. So it turns out that ACE score has a very distinct correlation with promiscuity decades later. Ever had a sexually transmitted disease? Well, you see the same thing. Perhaps not so surprisingly once you know this. That is, the ACE score goes up, the adjusted odds ratio for a sexually transmitted disease goes up. If we look at smoking, and smoking, big scale problem. Cause of a lot of humid wreckage, a lot of medical care cost. If we look at the probability of smoking and match that against ACE score, what we see is that there is again this same dose-response relationship. The higher the ACE score, the greater the probability of a person being a heavy smoker. There's an interesting concept here that I will try to remember to come back to, but it's illustrated in 2 videotapes that I've brought along. One is entitled ACE Score 6, Lessons from the ACE Study. ACE Score 6, Pharmacologic Benefits of Nicotine. A very interesting interview with a man who uses nicotine. Smoking is kind of an irrelevant delivery system because nicotine patches at multi-patch doses work equally well, who uses nicotine pharmacologically to control otherwise uncontrollable rage. He very nicely explains the origin of uncontrollable rage. So if you're interested in that subject, take the videotape ACE Score 6. Another videotape that I brought along relating to smoking is titled Why I Smoke, Lessons from the ACE Study. This is an interview with a woman who is embarrassed that she is still a 3-pack-a-day smoker, down from 5, 3 years after she was seemingly successfully operated for lung cancer. She explains it has made it very difficult for her to have any kind of meaningful professional relationship with the physician, because they all start off by saying, don't you know, as though she were living on Mars, don't you know, there's really nothing I can do for you as long as you continue to smoke. We are used to thinking of these things as being bad. I hope you get the idea as we go along that for the person involved, they are not bad, they are not self-destructive, they are indeed useful coping devices. And the question is, what is it that they're being used to cope with? You might guess by the title of the talk. That's a tremendously important idea. No one shoots up to get endocarditis. People shoot up because nothing comes close to heroin if you desperately have to feel better in 1 minute. If you need so badly to feel better in 1 minute that what might happen in 6 weeks or 2 months is an easily affordable price to pay. The failure of most public health programs to deal with so-called public health risks, health behavior risks, or worse yet, self-destructive behavior risks, centers exactly on this misunderstanding, namely that for the person involved, this is not a problem, it's a solution. And we are asking people to give up a solution without having any understanding of what the problem is, without having any understanding or willingness of helping them either deal with the problem or find some alternative solution. This is a theme that will come back again and again. If we look at other aspects of smoking, initiated smoking by age 14, well, yeah, obviously the cigarette companies run ads. I mean, they're very effective. They're in business. The piece that isn't so obvious is that they help people. They kill people too. But short term, they help people. That's a very, very important idea that we're not used to thinking about. If you look at initiated smoking by age 14, clearly associated with ACE score. Whether a person is a current smoker, the prevalence of smoking in California is much less than most of the country. But in this California population, you can see a very steep dose relationship, dose response curve between whether a person is a current smoker and their ACE score. Whether a person has chronic obstructive lung disease has a clear relationship to ACE score. Ever abused alcohol? I think the question that we used was, have you ever considered yourself to be an alcoholic? Kind of blunt. ACE score 0, little less than 3%. ACE score of 4 or more, 16%. If you look at odds ratio, it's a 7.4-fold increase, a 740% increase. Again, a strong relationship between whether a person is an alcoholic and their ACE score. The higher the ACE score, the greater the probability of their being alcoholic. I mean, it helps to ask yourself the question, why is a person an alcoholic? We usually escape answering that question by some superficial response like, well, because they're addicted. ACE score compared to intravenous drug abuse. Kind of interesting. ACE score of 0, probability of 0.3% of ever injecting drugs. We set that as the reference point of 1. ACE score of 4 or more, the reference now, the odds ratio increases more than tenfold. That is to say, a 1,300% increase. That's a big number. Not shown here is an ACE score of 6 or more, and that jumps to a 4,600% increase in the probability of ever using intravenous drugs. If we compare ACE score to HIV risks by looking at ever injected drugs, 50 or more intercourse partners, sexually transmitted disease, by just conglomerating those, I think the point is pretty clear. If we look at ACE score compared to depression, and that was defined as chronic depression within the past year, and you have to understand that most people try to deny that. ACE score of 0, 14% prevalence. We set that as the standard, as the reference point of 1. ACE score of 4 or more, 51%, a 4.6-fold increase, a 460% increase. It's hard enough to get physicians to recognize depression in their patients, partly because we don't want to fall into a hole that we're afraid we might not get out of, partly because patients collaborate wonderfully by trying to deny that. So we never really get very often even to the position where we could ask the question, why is somebody depressed? Well, here's a very interesting explanation. Are there chemical markers for this? Oh yeah, sure, absolutely. Does it affect serotonin levels? Sure. But, why? Why do some people have wrecked up serotonin levels and others not? Anything we do in the central nervous system is going to have neurochemical mediators. If I get nervous and my feet get cold, and I biopsy the skin on my feet, there would be chemical differences there. You kind of missed the point if you didn't understand that the chemical difference was a marker of an emotional experience. If we looked at suicide attempts, we see a rather dramatic rise. That as we get to an ACE score of 6 or more, we now move to a 16% prevalence of attempted suicide. If we look now at the question, ever sexually assaulted as an adult? It's an interesting question. What we see is the probability of that is categorically related to ACE score. A better than 6-fold difference. How does that come about? How could the way a person was treated as a child have to do with the probability of being raped later in life? Well, the most obvious thing that one learns talking with these patients is how remarkably unself-protective they were. How something seems to have occurred that destroyed their ability to see what was going on around them, that had destroyed their ability to protect themselves. And when one looks at that carefully, it's very easily traceable back to what happened decades earlier. If we look at how ACEs, adverse childhood experiences, affect the risk for heart disease, for stroke, for cancer, for pulmonary disease, for diabetes, for pneumonia and influenza, the link to diabetes is obviously mediated through obesity. And we look at the risk factors for these conditions, which are quite well understood, namely smoking, severe obesity, and no recreational physical activity. We see that the prevalence of smoking clearly relates to ACE score, that the prevalence of severe obesity clearly relates to ACE score, that the prevalence of no recreational physical activity relates to ACE score. Let's for a minute now switch from the medical consequences of adverse childhood experiences to other implications for adult life. For instance, how do ACE scores relate to job performance? Well, when we matched time lost from work to various host factors that I've just shown to you are tightly related to ACE scores, what we see is this: people who had lost 2 or more days from work in the past month. Smoking increased the probability of 2 or more days lost from work in the past month by a third, by 33%. Major obesity by 70%. Ever in a lifetime use drugs by 80%. Having current family problems by 100%. Having current financial problems by 130%. By ever being an alcohol abuser, self-defined, by 190%. Ever attempted suicide increases the likelihood of having missed 2 or more days from work in the past month by 240%, and being depressed within the past year increases it by 260%. Are these prevalent? Yeah, appear to be. If we ask people, do they themselves consider that they have serious job problems, serious problems in carrying out their work, the likelihood of somebody answering yes is very clearly related to ACE score. The adjusted odds ratio runs from 1 to 2.5, so there's a 250% increase in the probability of a person feeling that they are performing poorly at work and the correlation that has to ACE score. So what we see is that most or much of what causes time to be lost from work is actually determined not by what's going on now, but by what happened decades earlier, specifically by what we are calling the adverse experiences of childhood. Now, what does this have to do with survival? Well, that's kind of interesting. When we did a decile analysis, that is to say, break up a lifespan into 10-year periods and look at the prevalence of any given ACE score within that 10-year period, you'd expect it to be the same. In other words, if you look at people from the age of 20 to 30, you'd expect the probability of an ACE score of, let us say, 3 to be the same as in the age range of 30 to 40, as in the age range of 40 to 50, as in the age range of 50 to 60, 60 to 70, 70 to 80, etc. The world hasn't changed that much. 30 years ago the president was murdered, 50 years ago there was a world war going on. Well, the interesting thing is when we did that, what you might expect does not occur. When you look at people who have an ACE score of 0, and you compare that over a lifetime, you find that there are more old people who have an ACE score of 0 than there are young or middle-aged people. Or, stating it a different way, if you look at the prevalence of an ACE score of 2 in a population that is 19 to 35, in a population that is 35 to 50, 50 to 65, and 65 or older, what you see is that there are a diminishing number of people with an ACE score of 0 as they get older. And if you look at an ACE score of 4, you really see a diminution. Where did they go? They died. They died. That was kind of hard for us to understand for a while. They died. The people with adverse childhood experiences don't live as long as people who don't have adverse childhood experiences. Why not? Well, we've seen already. The intervening mechanisms, drug use, promiscuity, heavy smoking, obesity, alcoholism, etc., all of those things that are put into play as the best solution at hand for that particular individual ultimately have long-term destructive effects. So what we learned ultimately could be depicted in this pyramid. If we look at premature death, we know that that's underlaid by certain common diseases. Let's say you take somebody who dies at 50 of a heart attack. Well, why would somebody die at 50 of a heart attack? Well, common example might be a diabetic smoker. That would hardly surprise anybody. But why is a person diabetic? Well, overwhelmingly because they're fat. But why is a person fat? And the smoking, why does a person smoke? Those are questions that are not asked. They should be, because they're answerable. We know that these diseases have certain underlying risk factors, and those are related to lifestyle. Smoking is considered to be a lifestyle factor, nice benign term. Obesity is considered to be a lifestyle factor. But why do these things exist? What we've shown you is that they are traceable back to here. And that the ultimate causes of death, of premature death, are often traceable back to here. The implications of what I've shown you are several and profound. 1, adult health and mortality is significantly determined by experiences decades earlier in childhood. The determinants are emotional rather than physical. The determinants are unrecognized because of time separation of decades and because of social taboos against inquiring into these areas. The medical costs are enormous, but they're more easily calculated than the social costs. The social costs have to do with things like unemployment, welfare, prison, etc. Nobody likes to think about those. Those are all kind of dismissed and pushed out of the way unless you happen to be a social worker. But it's interesting how the social work literature and the medical literature, which really have a great deal of information to share for practical purposes, are miles apart. And repairing the consequences is so difficult that primary prevention really seems the more reasonable approach. Now, I'd like to go from the general and the conceptual back to the concrete and specific. A patient I've known for many years, since I took care of her husband when he was dying of metastatic lung cancer 20 or 25 years ago, has accompanied me, and she has agreed to tell you some about her life. More importantly, she's agreed to answer questions so that you can leave with some personal experience that all of this is possible to talk about openly. Mrs. M.
This is not an easy thing to do, to open your life to people that you don't know and to tell things about your life that you, for many years, spent your full time trying to hide. I guess you would call me a victim of childhood sexual abuse. But in the last few years, I have tried to turn that around, and I have now come to the conclusion that I'm a survivor of childhood abuse. And I am trying, with working with Dr. Felitti, I've made a video for him that he uses in for training purposes. And in speaking to you today, I'm trying to make people aware of the terrible things that can happen when children are abused sexually. And the sad part is that all the time that I was growing up, when these things were just destroying me, there was no one that I could talk to. And I think you people are in a unique position to be able to sense some problems early on and to be able to talk and to discuss these things with children and young people. Because if somebody had been able to talk to me when I was a child and had let me get these things out in the open and help me understand them and help me find ways to overcome them, my life could have been a lot different. My sexual abuse started when I was between 5 and 6. I can't specifically remember the very first incident, but I can remember specifically many incidents around the time, from the time I was 6 until I was 14 or 15. My father was an upstanding citizen. He was a pillar of the church. He was a very active community service person, and people thought he was a saint. But he started sexually abusing me when I was very small. And I had adored him. He was my hero, my idol when I was a little girl. The family pictures show that I followed him around like a puppy. I really loved my father. And so his approach to me, when I think of sexual abuse, I don't like to use that term in my case, because when I think of abuse, I think of actual physical, painful harm. My father never treated me brutally. He was always very gentle with me, so it was not something that made me afraid of him. I don't think I ever gave any thought to what was happening. I didn't know what it was. And it wasn't until I started interacting with children at school, and I had 3 older brothers, and I spent a lot of time with a lot of boys because that was who was around, with 3 older brothers. And so I began to pick up things, and the word incest came to my mind, and I was instructed on what that was. And up until that time, I had never thought there was anything wrong with what was going on. It was rather a pleasant experience. As I say, my father was always very gentle with me, and as a result, I was introduced to sexual pleasure way too early because I didn't know how to handle it. And when I found out what it was and that it was wrong and how evil it was, I was horrified, and my greatest fear was that my mother would find out, because my mother spent all her life protecting us children, and she would have been horrified had she ever known. I think it would have killed her, I really do, if she had ever known. So I spent the rest of my growing up years not only protecting my father's reputation, but protecting my mother from finding out. And it was about this time when I began to be aware of what was going on that I started gaining weight. I'd been a perfectly normal little girl up until that time, and the pictures indicate that in the family photo albums. I was a slender young girl, but about the time that this became obvious to me, I changed drastically and became a very much overweight young girl. And when I was in the 7th grade in junior high school, I weighed over 200 pounds and have struggled and struggled and struggled to get back down below 200 pounds for the rest of my life. But one thing it did to me was it took away my sense of self-worth. When I found out what had been going on, like so many children in those situations, I think, I felt that I had done something wrong. I felt it was my fault. And I was a bad girl. And I was afraid often that people would know what had been going on. I figured there was some way by looking at me that they could tell that I was a bad person. And I spent a lot of time, I suppose I was in depression and didn't know it when I was a young person because I felt so worthless. So I spent all my life trying to prove to people that I was worth something. And as I say, when I was about 14, I finally confronted my father. And I said, this is wrong, and I'm not going to do this anymore. In the first place, it's wrong, and in the second place, I might get pregnant. And that horrified me. And so he put up no argument or he didn't try and make an issue of it. But from that day on, I never did anything that pleased my father. I couldn't do anything right. He belittled me. He disparaged my friends. He discounted everything that I accomplished. And it made me so... I had such a lack of self-worth that as I grew older, and of course being fat, I never had any dates in high school. I was friends with all the boys in school. We were good friends. I loved to dance, and I went to all the dances, but the boys didn't ask me to dance. I was always the one they picked to be in charge of refreshments and playing records. I went because that was my only social outlet. But then when I went into nurses training after high school, I was on my own for the first time, been, away from home for the first time, and I was put in situations where I could make choices about the way I behaved myself. And the very first young man who ever paid any attention to me, I fell madly in love with. A very unworthy person. And it ended up that I became pregnant, and we were married, much to his disgust. He was drafted a month after I was married, and I didn't see him again until our first child was 8 weeks old. And then I spent 6 months with him and became pregnant again, and he didn't see that child until she was 6 months old. And he came home from the Army with his discharge papers in one hand and a blonde in the other, and I always said that was not my idea of community property. And so we were divorced, and for 11 years I was on my own, raising my 2 children, working sometimes at 2 jobs. And during that time I had relations with several different men, but it was not because I thought they were what I was looking for. It was just because they paid attention to me. And that was directly related to the fact that I had such low self-esteem that I didn't think any decent man would want to have anything to do with me. And after 11 years, I'm shortening this because the time I think is growing short, but during that time I had a problem with drinking, the only time in my life that I ever had a problem with alcohol. But that seemed to help ease me through social situations when I felt apart from couples and felt lonely and rejected and so forth. And the reason that I quit that was because one night I was coming home from an office dance, and I'd had too much to drink, and I came very close to wiping out a whole row of parked cars. And it's, as they say in the law circles, it scared me straight. And I haven't had any problem with alcohol since. It never was a real problem with me. I just was using it as a tranquilizer, I guess you could call it. I've never smoked. I'm a poster girl for this program, except that I don't fit the smoking and the drinking categories, but the rest of it you can apply to me. Then in 1956, I was introduced to a gentleman, and we met on the 23rd of December, and on the 12th of April we were married. We were meant to be together, and this man treated me with such respect and such love, and we had a marriage that was storybook marriage. But after 15 and a half years, he died of cancer. And I was again left on my own, and that was 25 years ago last December. And so I've struggled with this problem of self-esteem and trying to control my weight and trying to prove to people that I'm worthwhile when I have felt so unworthy. And I have managed to overcome a lot of that in some ways. I was in the construction industry for 35 years. I worked on many large projects, including the high-rise Metropolitan Correctional Center, the federal prison downtown. That was one of my projects. And I worked on a big $2 billion power plant project up in Wyoming, and on some hotels in the Los Angeles area. So I really had a good career. I loved the work, and I did well in it. So I feel that I've been able to accomplish a lot. In the last few years of my life, I have been able to feel much better about myself. But my growing up years and my young adult years were miserable because I felt so used and so unworthy and so damaged goods. And I can tell you now, however, that before my father died, I was able to go to him and confront him. And I always felt that if I could just understand why he did what he did, that maybe it would be easier for me. And I confronted him, and he said, I don't know why I did it. If I could undo it, I would. But I was able to tell him I forgave him, and that gave me a certain measure of relief from the rage that I had felt all those years. However, that rage was fueled again when I found out that he had done the same thing to my sister and to my daughter. And my daughter has been severely affected by this. She's still a very bitter woman. She never could forgive him. She has developed, she's very overweight. She has multiple sclerosis and has developed diabetes. So it's a long-lasting. It didn't end with me. And I was always kind of grateful that my daughter didn't have any daughters so that this might be stopped. But I think the point that I would like to make to you people that if you deal with these people, with children particularly, because if you can get them when they're young, you can save them so many years of misery and as they showed, disease and promiscuity and all the things that go along with it. It'll be worthwhile. If you can save one child, that's an accomplishment. But the biggest thing you can do for these children and these young people is to listen to them, encourage them to talk about it. They need to talk about it, and they need to talk about it to someone who is not judgmental and who is not critical. I tried to tell my brother, one of my older brothers, one time when I was an adult, and I went to a convention in Chicago, and he came into Chicago and met me for dinner, and we got to talking about the family and whatnot, and I tried to tell him about what had happened when I was a child with my father, and his reaction was, Helen, you've got the best imagination I've ever seen. He said, I do not believe it, I know Dad, and he would never do anything like that. So once again, I felt like I was you know, I was the person with the black hat in this thing. But anyway, listen to them and encourage them to talk it out, and above all, help them understand that it is not their fault. I was 5 or 6 years old when this started with my father. What could I have done against him had I known what it was? I couldn't physically have warded him off. He was a big man. I had no weapons with which to fight it. So help them understand that it is not their fault. Now, I know this has been a kind of a sketchy coverage of this whole lifetime of misery and wondering and pondering, but if you have any questions, I would be very happy to answer your questions. Yes?
As a young girl, if someone had asked you, do you think you would have told?
I think if the question was, as a young girl, if someone had asked me, do I think I would have told? It would depend on who did the asking, because I was so protective of my mother. I didn't want anybody around the family, you know, that it might get back to her. I didn't want to talk about it. The one time that I did get help was when my children were small and I was divorced and struggling to support them. I went to family service here in San Diego thinking my children needed help, and found out I was the one that needed help. And I was very fortunate to get a counselor who was very, very good at listening. And she's the one, I have to tell you, that I had a recurring nightmare that's kind of significant. For years and years, I had this terrible nightmare about being on the side of the road, sitting there, because I had been bit by a rattlesnake. And people would come by, and I would try and tell them that I had been bitten by a rattlesnake and I needed help. And I knew from my first aid experience, incidentally, my father for many years was a Boy Scout executive, and he taught first aid to instructors. So I learned first aid from the time I was that tall. I knew that if you get bitten by a rattlesnake, you should stay calm, because the poison spreads faster if you get hysterical. So I was trying to stay calm, and nobody would believe me that I'd been bitten by a rattlesnake. And this went on for years. I'd wake up just panicky because nobody was believing me. Well, this counselor at family service was able, through over a period of 2 years, I went every week, 1 day a week for 2 hours, and she was able, through counseling, to help me get over that nightmare. And I was grateful for that. But it would have had to have been a special person to listen. I would have talked to a doctor, but I never had a doctor that how shall I say this, treated me as a person with anything particularly interesting to say, except whether my head hurt or my stomach hurt. Yes?
When did you find out that your sister was sexually molested, and did her adult life violate yours?
No, I don't know how I don't think it was as severe with her. I think it was very mild with her, according to what she tells me. The question was, how did it affect my sister? I found out about that when I was middle-aged. I didn't know about it for years and years. And it was interesting, neither one of us ever told our husbands about it. We were not willing to risk loss of esteem in the eyes of our husbands. Yes?
What about your daughter?
My daughter did not, the question was, what about my daughter telling me? My daughter did not tell me about her experience with her father until I chose to talk to my children about it.
With her father or your father?
My father, yeah,
Your
her
father.
grandfather, I'm sorry. Yeah. The reason I chose to talk to my children, this is true confessions. I was involved with a married man for many years after my husband died. And my children knew that I had gone to Hawaii about 4 different times to be with him. And I began to be very concerned about what they thought about me, because they knew this man was married. And so I sat down and tried to be as open and as frank with my children as I could. And I explained to them all these things that had happened to me and how it had affected my life, and I hoped that they would be a little understanding that the reason that I was seeking affection from somebody inappropriate was because my whole life had been a search for affection, and that I would hope that they would be understanding, and that's when these things came out with my daughter. I had also told them, I not only told them about being raped when I was in nurses training, I also told them that I'd had an abortion later on in life. And so I thought by being perfectly open and frank with my children, I could help them understand these things more and maybe make them more understanding people.
Did it work?
It worked. My kids support me wonderfully. Yes, sir.
You mentioned a time in which the behaviors became stigmatized and you felt guilty about it. Prior to that, would you have told someone what was happening, or was there already some sense that this was taboo, that this was bad?
The question is, would I have talked with someone prior to the time that it became very obvious to me that it was wrong? Is that your question? I don't think so, because I was innocent and didn't know enough to know that it was wrong, and I didn't know. I did have a sense, I can still remember having a sense that it was something that I shouldn't talk about with my mother. Although I don't remember my father ever threatening me or telling me to keep my mouth shut or anything like that. But I had that sense that it was not something we talked about. And of course, that was something nobody talked about in those days. I mean, incest was a subject that was just not considered suitable for family discussions. Yes?
Have you had group therapy ever, and you've been on, has any physician ever offered antidepressant or some kind of serotonin uptake inhibitor medication for you?
The question is, have I ever been in any kind of group therapy, and has any physician ever prescribed anything medically to help me? And the answer to both those questions is yes. The Kaiser Foundation has the Positive Choice Program, which covers a lot of territory, and part of that program provides groups. And I was in 2 or 3 sessions of what they call the drama workshop, which was very helpful to me because I enjoy writing, and there was a lot of writing involved in that, and it helped get a lot of things out in the open. And yes, I have been prescribed certain drugs to use, which have been helpful to a certain degree. But remember, I'm 75 years old, and you don't change your habits easily at that age. You change attitudes, but it's extremely difficult to change habits, like eating everything that isn't nailed down. Yes?
In discussing this with your father when you confronted him, was there any time that he was able to look back into his childhood and express what perhaps had happened to him? Was he an abused child?
The question is, when I was confronting my father about this, was there ever a chance when he discussed what had happened in his childhood that would explain reasons behind this? And that, I'm glad you asked that question, because that's something that I've been thinking a lot about lately. When I talk to family members about this, or when I talk to my very close friends, they have nothing but scathing remarks to make about my father, and what an animal he was, and what a no-good, self-serving, power-hungry person he is. And that's not the picture I see of my father. Because it has come to my understanding that if I'm expecting people to understand me and why I have done the things I've done, how can I not give my father that same privilege? I have no idea what his childhood was like. I know his father was a very controlling, very harsh individual, and an alcoholic. Now, I don't know, according to the charts that you saw, my father probably had a good chance to have been affected by that kind of a childhood. So maybe that was just, that was why he was the way he was. But anybody that you would talk to, anywhere we ever lived, if you mentioned my father, they would have nothing but high praise for him. He was a prison official for many years with the state of California. As a matter of fact, when he was ready to retire, they asked him to stay until he was 70 because they wanted him to revamp the security system at Atascadero State Hospital for the criminally insane. He spent a lot of time working with people that were incarcerated for the very thing that he had done. So I always had that feeling of extreme hypocrisy. But I can't force myself. What he did was monstrous. But I can't force myself to say that he was a monster, because he did so much good for so many people in so many ways that I have to take that into consideration. Yes.
In doing what you've done and speaking out, have you caused any rift in your family between your brothers and sisters, especially the brothers who believe?
Unfortunately, that brother died last year, so it wouldn't affect him. She asked if my attempts to speak out on this subject, how has it affected my family? Has it caused any problem with my family? And before I made the video, before I agreed to this today, I checked with my family and asked them how they would feel about it. And they showed just a little bit of unease, but really supported my doing what I'm doing. Yes.
Do you talk to survivors groups or like groups of, like, say, adolescent girls who are looking through this now?
No, I haven't been involved in anything like that yet. I might eventually. I don't know what Dr. Felitti has in mind for me.
Might have a new career.
I might say I'm fairly good at public speaking, and I enjoy doing it, and my fees are reasonable. So if any of you would like to, no, but I really do feel that if there's anything that I can do in this field that would help people be more aware, it would be almost worth it.
Can you describe the circumstances and discovery of the abuse of your granddaughter?
Of my daughter?
Your granddaughter.
No, I don't have a granddaughter. It's my daughter that was abused by her grandfather, my father. Yeah. How did I find out about it? She told me. She was, she was probably 30, 35.
What do you think brought it up that she told you then? Why not 10 years earlier? Why not 3
Because
years
it was
later?
at that time that I came clean to my kids and went through all this with my children, because I didn't want anything to ever come up and surprise them. And so I told them everything that I thought was relevant, and it was at that time that she told me.
And why did you start talking about this at that particular point in your life?
Because I felt so guilty about what I was doing. I felt so guilty. I'm a Christian woman. I like to think of myself as being a Christian woman, and adultery was not on the list of things that were approved for general consumption. And although I had a very hard time giving up that relationship, and actually it didn't end until the gentleman and his family moved to another state, not because of that, but through other circumstances, that the relationship ended. And I felt so guilty about that, and I was always afraid that something would come up and my children would be embarrassed by learning for the first time from somebody else about my activity. Yes?
I was curious about something. It seems like you hear this a lot. The daughter will be abused, and then the granddaughter will be abused by the person's father. And it seems like that's repeated. If the daughter knows, then how come the daughter gets the granddaughter?
In other words, you're asking, how couldn't I protect my daughter from this? Okay. I was very aware of the possibility that this might happen to my daughter. And so I always tried to watch her when my father was around. And I always tried to make sure that they were, that everything was okay. But what happened, she became ill with rheumatic fever, and she was supposed to rest every afternoon after school. And I was working full-time, couldn't afford full-time childcare, so my kids came home after school. And I would come home from work and find that the neighborhood kids had been in and out of the apartment. She'd been running around being, you know, a typical young girl. She was 11 years old at the time. And so because of that, I was forced to send her to my parents for a time until I could make better arrangements for her after school care. And it was during that time. And when I was ready to send her up there, I talked to my father. And I told him, I said, this is something I have to do, but I want you to know that if I find out that you lay a hand on her, that, believe it or not, my father, I would be tempted to kill you. And he was aghast. He said, I would never think of such a thing. And it never occurred to me that he would. But he did. Yes?
Was the abuse of your daughter just a singular incident, or did it go over time?
It was over a few months' time, and it was several incidents. And she told me, because of my confrontation with him, apparently, he told her that she'd better keep her mouth shut or she'd regret it. And so she was afraid of him. I was not afraid of my father, but she was. When I confronted him, he didn't actually say he was sorry. He said, if I could change it, I would. Those were his exact words. He said, I don't know why I did it. And I said, well, I just want you to know, I do forgive you. I can't forget it. I do forgive you. And I love you because you're my father, but I don't like you very well. And that helped me.
Small kid, which is about 3 years old, living, with the same grandmother.
What is my advice? My advice is for the adults in the family to watch carefully what goes on. And please people, you may think that the adult, now this is not just sexual abuse against little girls, it happens to little boys too. Be aware that no matter what saint-like attributes people in your circle have, it ain't always necessarily so. And you just have to be aware. And I think it was so far from my mother's sphere of possibilities that she would never have thought of anything, because she was very protective of us in other ways. But and the hard part for me, I adored my mother. She was the nearest thing to a saint I ever knew, and but she unwittingly was a catalyst in some of this, because when I got to be up in junior high school, my father was in a job where he had to travel quite a bit, and my mother encouraged him to take me with him. And the reason she did that was because I was doing so well in school, and we lived in a little rural area, and she thought it would be a good idea for me to get out and see, new places and meet new people. And I'm sure, I know I've examined this in my heart many, many times, and I know without a doubt in my own heart that my mother had no idea what was going on, and yet she unknowingly made some of this abuse possible. Yes?
Do you think she would have believed you if you did tell her?
I think she would have. The question was, do I think my mother would have believed me if I had told her? She would have believed me, but I couldn't have told her. Yes?
Did you have any chronic health problems as a young girl or as a young teen, like abdominal pain or headache or
No, just
depression?
obesity and depression. Yes.
You said that you thought you might have told a physician as a young girl if they had
Yeah.
asked you in an appropriate way. How would you have felt if they had then revealed that to your mother? Can you make any guesses on that?
I think I would have made it perfectly clear even at that time, as young as I was, that was my main mission, was to keep it from my mother. I would have exacted a promise from a physician or anyone else that they never tell my mother.
But with mandated reporting, there's...
Well, this was before the days of mandated reporting, so I don't know how it would be handled.
Answer to the first question, which is that we exclude people with any major medical illness during childhood, the answer to that is no. The answer to the second question, where is this going to be published, the anchor manuscript for this information will be in the May issue of the American Journal of the American Journal of Preventive Medicine. There will be 3 accompanying editorials with that article, and over the next several years there will probably be, we estimate, about 15 to 20 other derivative articles on various specific aspects of this. Adverse childhood relationships related to the ability to work, perform occupational medicine, etc., related to teen paternity, and so on.
I'll take this question first. That's a difficult one to answer. What do I attribute my ability to have survived this kind of relationship and experience? I'm stubborn as hell, for one thing, and I object to being a victim, and I have a sincere desire to help other people not experience the same things I did. And I really feel strongly that this subject is not talked about enough in certain circles. And I think that everybody, not only doctors, nurses, social workers, teachers, ministers, child care resources should somehow receive training in listening and observing and detecting signs of emotional upsets. Like if someone had realized when I was 7 years old that I suddenly started gaining weight, they might have questioned why, but nobody ever did. And that might have been a clue to something going on in my life that was not right. For someone that had been perfectly normal up until that point and then became grossly overweight. I don't know. I don't have all the answers at all. But
the one thing that you've often mentioned to me was 15 or 20 years of a good marriage was an enormous...
Yes, the fact that I was so fortunate in my second marriage, that 15 and a half years, was what really saved me, I think, because my husband built up my self-esteem to the point where I felt that I really was a worthwhile woman. And although it didn't last nearly long enough, it lasted long enough to give me a boost to get me over the worst part of it. Yes?
Thank you very much for your candor. This is a remarkable presentation on your part. And you need to do more of this.
And because this is kind of a grim subject and is kind of a downer, I'd like to leave you with a little bit of humor. Most people start their speeches with humor. I prefer to end it with humor. When I was in Afghanistan, I was walking down the street one day on my way home from the office to the place where I lived, minding my own business, primly walking with my long skirt, my long sleeves, and my umbrella. The midsummer sun in Afghanistan is really cruel. Had my umbrella up, minding my own business, when a young man on a bicycle came swooping by me. And as he passed me, he reached down and grabbed my buttocks. And without even thinking, I whacked him over the head with my umbrella. Well, a couple of nights later, I was at a dinner with some fellow team members. You have to remember these team members were from all over the world, from many different denominations, so we had varying attitudes about things. And I was telling this story, and one of the women said to me, "Helen, that was totally inappropriate and distinctly unchristian." And I said, "Well, what was I supposed to do?" She says, "What does the Bible say you should do?" And although I agree, the Bible says turn the other cheek, I didn't think that was appropriate. Thank you very much.